Hi there, and welcome back for our community conversation with the East Cleveland Public Library. Hope all is well with you and your family. Hey, who do we have there?
Hey, Miss Murray, how you doing?
Hi, Maurice Cole. How are you?
I am great. It's good to see you.
It's so good to see you too.
It's good to be seen. Amen.
Yes. What brings you to the neighborhood, Maurice?
I am here to talk about the Prevent Premature Fatherhood program at the Cuyahoga County Board of Health.
Okay. Cuyahoga County Board of
Here's a
Health.
brochure.
Thank you. We'll get to that.
Yes.
Now, Cuyahoga County Board of Health. You do a lot. Can you just hit a little bit about some of the things that you
we've been
do?
around since the 1900s. It's established in Ohio Revised Code for the health department to exist. And there are 57 municipalities in Cuyahoga County, 2 health districts. The city of Cleveland has their own Cleveland Department of Public Health, and we cover the other 56 municipalities. So
wow,
keeps us busy.
You got a big staff there?
We do have around 150 people, nurses, social workers, dietitians, sanitarians.
The whole
gamut. Yeah.
The whole gamut. And you serve, versus the information that you provide is for all ages.
Yes, absolutely. I mean, we cover newborns and moms. We visit them in the hospital to connect them with services. Teenagers with the Prevent Premature Fatherhood program. We'll talk a little bit about that. We also serve seniors in the community. Pretty much along the life continuum, we're here to serve the community. We want to promote health and, really just encourage folks to live their best lives.
Okay, great. Because Cuyahoga County Board of Health is what I call a behind-the-scenes hero. People don't have no idea what you do, but you are a jewel in the community. Now, we're all dealing with the COVID-19, the Delta variant. Can you tell us what role Cuyahoga County Board of Health is playing with that? Many roles, I'm sure.
Yes, we have definitely been on the front lines, and so it's required that anyone who tests positive in Cuyahoga County, that wherever they test, that gets reported to the Ohio Department of Health. And then within a certain period of time, the Ohio Department of Health then needs to report that to the jurisdiction where that person lives. So for people in the city of Cleveland, then their health department is notified, but again, for everyone else in Cuyahoga County, that comes to us. So we are assigning people to talk with those cases. We also need to identify and reach out to folks and make sure that they know that they are indeed positive for COVID, to get them a letter of isolation, but also then to find out who they may have been in contact with who could also potentially be exposed, because those people may need to be quarantined.
Correct.
Yeah.
And that's the dangerous and scary thing about COVID, is the domino effect.
It is, and the truth is, sometimes they say that public health is a story that's never told, because you don't necessarily need to see us, right? We're working for the community, but maybe it is sort of behind the scenes. But in a moment like this with the pandemic, we are front and center with so many other public health practitioners that are trying to keep people safe. And it is a scary time, but we're still here. But we've also lost, 600,000 people that won't ever get to sort of share the joy of this sunny day, or to sit down for a casual conversation like we're having again. And I think we have to acknowledge that, even though we also need to find the strength to kind of press on.
Mm-hmm. And that's why the work that you all do is so important, as well as our community services such as libraries.
Yes.
They help to continue to work together in a collaborative effort to get the word out.
Yes.
You brought me a brochure. Can you tell me a little bit about this?
Absolutely. So this is the Prevent Premature Fatherhood program. We are serving youth ages 12 to 19 in the greater Cuyahoga County area. We've actually partnered with the East Cleveland Public Library before to offer sessions here. So this program is really about facilitating conversation with young people where they are. Mm-hmm. And we want to talk with them about not becoming a parent before they're ready.
Okay.
And so we've got 5 lessons, healthy relationships, exploring the role of gender, consent, and then 2 sexual health topics to kind of have that conversation. We want to offer medically accurate information, without sort of judgment or shame. Mm-hmm. We're going to trust folks to make a decision that suits them, hopefully that's in their better interest and very health-minded. But yeah, it's been around for over 10 years. We are funded by the Cuyahoga County Fatherhood Initiative, and Al Grimes has been a great leader and champion for families in that capacity. We also want to connect young people who may be parents with some of the services that are available in Cuyahoga County, because again, sometimes that public health story doesn't get told and people don't know where they can go. So hopefully by watching your program today and you kind of letting us amplify some things, people will be a little more informed moving forward.
Okay, this is great. When prevent premature fatherhood. And any time youth are interacting in this capacity, it's a very touchy subject.
Yes.
But I want to say I had the pleasure of attending one of your programs, and the way that you handle it and dove in and engaged the youth, it was great. Everybody felt comfortable about a subject that sometimes can be a little
It can be a little tough to have some of those conversations, but also I think that I have found that youth are generally just happy that someone is willing to like engage, to answer some of those questions, because sometimes there's misinformation out there.
Always.
Like sometimes folks think, well, hey, if I do this but I go and stand on my head, then maybe there won't be like a consequence for that action, and that's just not how gravity works. That's not how things go. And so we want to talk about avoiding unintended pregnancies. But we also want to talk about like how to protect oneself from some of the sexually transmitted infections that are out there, including HIV, which is something that never goes away. If someone is infected with that, then that's something that they'll have to contend with for some time. And if we can avoid coming into contact with those infections and being like responsible for our sexual health, then that opens up much more opportunity for us.
Well, Maurice, you are just a wealth of information, aren't you?
You're too kind. You're too kind.
How long have you been with the agency?
So I have been with the Board of Health for 15 years, and I've been in Cleveland 21 now. So most of my formative years, if you will, have been in public health at the agency, and it's one of the best decisions that I ever made. I didn't know that when I took that first job at Case Western in 2000 that was public health. I didn't have sort of the concept of how these different, sort of fields are connected.
Yes.
But I learned that in the training there at Case, and then I parlayed over to the Board of Health in 2005, and I've been there ever since.
Good. And I love the way the organization is constantly growing
Yes.
to meet the needs of the community and whatever the COVID or wherever happens that affects families and people on a large scale.
Yeah, we just want to again encourage people to live healthy lives, to thrive, right? And I think in the midst of this pandemic, myself included, like there have been moments where I'm surviving and I'm very grateful for that, but I also want to thrive. I want to really sort of embrace all of life, and I'm getting back to that place, but it's been rough. So I think we have to extend ourselves grace. Grace for ourselves. We have to extend grace to other people. And sometimes, if someone's having a bad day, just be like, hey, it'll get better. Because we all need to, kind of hear that, to be affirmed, to, have someone root for us to be better the next day. Maybe that's what we need a little bit more of.
Yeah, because the stress is on now.
The stress is real. The stress is real.
The stress is real.
Yeah.
Well, I'm so glad you made it over to our community and stopped in to see an old friend.
Thank you. Yes, I have so enjoyed my time in East Cleveland. I've worked with students and faculty at Shaw High School over the years and serving folks here at the library, and also for our program. So this program is free. There is no cost.
Okay, anytime
young folks gather, we are happy to be there with them. We also have some swag items. We've got Bluetooth speakers and water bottles, sunglasses, and pens and pencils and some cool things. We also have these masks because we are dealing with this pandemic, so a little brand marketing, and I have a facial covering for you to wear with pride. But we're happy to see youth wherever they are, and there's also a food budget, so we'll have a pizza party when we're done.
Okay, we look forward to getting back to things would never be normal, but getting back to doing some of the things that we love to do.
Absolutely, and also this program can be virtual, so again, we have the opportunity to kind of broadcast to where youth can be, because the world changed a bit last March.
Yeah.
And we all had to sort of accommodate and adjust. And so we made the program virtual, so we have that in-person component, or we can be on Zoom as well.
Okay. Well, Maurice Cole from Cuyahoga County Board of Health, it's always a pleasure to see you. It's always a pleasure to speak with you and gather all of that information. And thanks, and come and see us again.
I sure will. And thank you, Ms. Murray, for all that you do. Your humanity just kind of shines through, and you're really a champion in this community and throughout the larger county. And I appreciate you. So thank you.
Thank you. That's been our community conversation for today. Hope you learned something and be safe out there. Take care.